Hi everyone, welcome to our COVID behaviour change webinar, where for the next hour we're going to be learning from peers and experts and exploring how we might strengthen systems to create sustainable public health initiatives. So we're going to be learning from practical examples and sector leads on how we might do this, and exploring practical tips and learning that our partners and colleagues are sharing today, and thinking about how we might connect with each other on this journey. Lisa, perhaps you could go to the first slide. That would be great. So before we get started, we'd really like to hear from you. I will just introduce myself and my colleagues. I'm Pippa Ranger from the FCDO, and with me facilitating today's webinar is Lisa, Raj and Geeta from Lisa from FCDO and Geeta from the Vaccine Data Collab, who will be guiding the discussion later, and also Jenny from Hygiene Hub and Ida from Unilever, who have been organising everything behind the scenes. So thank you to the whole team, we will get started with a very quick intro from everybody. So if you can access the chat, please could you share your name too, and organisation, and if you like, the country that you're based in or region, and we'd love to know what parts of the system or systems that you will be working on to increase the sustainability of your public health intervention. So Geeta's just popped that in the chat there. So while we're doing the intros, please do introduce yourself. That would be great. And then I will just run through quickly our agenda. We're going to start with some overviews of health system strengthening and wash system strengthening. So I'm really delighted to welcome Elynn from IRC WASH and Joe from FCDO, who will kick us off with that. And then we'll move on to hearing from some really practical experiences from our partners WSUP and GiZ. Really happy to welcome Bella and Margaret from GiZ and Tara, Elizabeth and Emmanuel from WSUP to share their practical experiences in low and middle income countries in education and public utilities. Then we're going to have time for discussion, which Lisa and Geeta will facilitate, and hopefully we will be able to get through all of this in the next hour. So please do ask any clarification questions for the speakers in the chat, and we'll respond, or they will respond in the chat, and then we'll go straight onto the discussion. And it would be great if you can come on camera and speak. We love to see each other. It's quite an informal thing, but obviously, please, if we're running out short of time, put questions in the chat, and we'll see how we get on. So now I'd like to thank you for sharing all of your intros and what you're working on. For anyone who's just joined, we're just sharing what your name, organisation, country, and what parts of the system you're working on to increase sustainability of public health interventions. Really great to hear what you're all doing, and that will also help the speakers. So I'm just going to hand straight over to Elynn Walker from IRC, who's going to talk us through WASH system strengthening. Elynn, over to you.
Great, thank you so much. Hi, everyone. Good morning, good afternoon, good evening. I know people are located in many different places. Thank you for this opportunity. And, you know, we are close to, we are only 8 years away from 2030, and the SDG goals are quickly coming. And so there are some ways, as I'll talk through, around how we think really system strengthening approaches can deliver not only SDG 6, but also the linkages to the other health and education and other SDGs. So we can, this is just showing that we're far away, but it's still achievable. So next slide, please. So why does the system fail? And I'll talk about what I mean when I talk about the system. But a lot of times the reason that we don't have sustainable service delivery has to do with apathy. The people who are supposed to care, which is not any of us on the phone call, but those that are in positions of power often, they don't care as much, or they don't necessarily have the political will to really drive things forward. The WASH sector and how it relates often to health and other sectors is often fragmented and siloed. And then there's something called systems blindness. And the systems blindness isn't that we don't know and understand what it means to deliver services, but we often miss the holistic picture of all of the components that are needed to ensure that the propeller is not the thing that drives the airplane. There's a lot of things that go into ensuring that you get on your flight and you reach your destination safely. So next slide. So one of the things that we think is a solution is a systems approach that centers on people. It looks at the users of water and sanitation services. It looks at the health and how it relates to health systems. Behavior change is a huge component of the system as well. And so that's the focus of what we're going to talk about today. Next slide, please.
I've changed slides. Elynn,
you did
I'm
change
not sure
slides.
that it's
Okay.
syncing.
It didn't sync, but that's okay. I've got the deck here also on my end, so I can just go and talk to the next slide in case it didn't go through on my end. So at IRC, we look at building blocks, and we understand the WASH system to be made of a variety of 9 different building blocks. Other entities and organizations have a different number of building blocks, but we see these as the foundation for what needs to happen in order for these things to all function in order for the WASH system to be successful. But here, one of the things as I go through these different 9 building blocks is that the WASH system works in collaboration with other systems, the education system, the health system, all of the different, it could be the transportation system. There's lots and lots of systems that work together. So it's kind of like a system of systems, and they all sit within a larger political economy. And in order to really achieve some of the larger scale, reductions in health, to ensure that people are living, healthy and economically fulfilled lives, all of the systems really need to be working together. So again, at IRC, we have 9 building blocks. The first building block is on policy and legislation. We have one on planning, one for institutions, finance, infrastructure, regulation and accountability, monitoring, water resources management, and learning and adaptation. And really, the WASH system is made up of people and technologies. So understanding their behavior, the motivations, the incentives for each of these different building blocks or these factors and actors is essential, but extremely complex. Breaking down that complexity into tangible and really manageable areas of priority is important, but we need to recognize that we always want to go back to that bigger systems picture, the relationships between the different building blocks. And so oftentimes we refer to these building blocks as almost entry points, right? They're entry points into the system. And you need to keep in mind that you want to address them all, but actually you need to start with the ones where there are often the largest challenges. So for those who have been involved in systems work, even though IRC has 9, I mentioned, their building blocks can range from 5 to 13, but they're essential. These are some of the essential things that make the system function. So interactions, as I said, between the building blocks is really what is most essential. So what's important to note is that the WASH system doesn't stand alone, but as I said before, it's part of that larger political economy. So the building blocks capture this complex socio-technical system around the behaviors, the services, and the governance that are needed to really deliver services in a sustainable way. If you can go to the next slide, please. Great. So this diagram really captures all of the different entities that are often involved. So this is the actor component. So, and within the diagram, it shows some of the functions that go along with that. But all of them are, oftentimes the arrows are pointing in a lot of different directions. And as you go through the process to do system strengthening and using assessment tools to figure out where to start, you want everything to start in the same direction. You want everything to be pointing towards that ultimate service delivery. So please, next slide. All right, so all of that is the concepts and the information behind the system. What I want to do now with the couple minutes that I have left is to talk you through a little bit of an example of the WASH system. And so I'm using Uganda and the Kabarole district as, if you can go back one slide, about that. So when I talk about the safe water system, it's the people. And so on the slide before, you'll see these are all the different people that are involved. Some of those are IRC staff, some of them are local government, community leaders. They're all working together in this kind of larger network to achieve system strengthening. Next slide. So if we want to make it a little less conceptual, we in Uganda here in the Kabarole district, we've been working with all kinds of district leaders for systems approaches. And so what you see here is the different aspects beforehand in kind of the process to achieve systems strengthening. So if you can go to the next slide. So what all this means in practice is that we're working in close partnership with political leadership in Kabarole. We are working with the district council and its chairman, and there are a lot of different actors that are involved in both water, sanitation, and hygiene work as well as water resources management. But all of the actors came together to create a master plan. And so this is a shared vision of universal access to services by 2030. And if you'll go to the next slide. What we see here is that the master plan really leads us to the desired future state. And so what we have, you can continue to click through. So what we have is network expansion. So we did an enormous amount of assessment in collaboration with the district, applying all of the different aspects. So making sure there was institutional capacity of the local government to do things like monitoring and knowing where they need to focus their resources, looking at what finance was there and creating a financial plan that aligned with the master plan, so that there was a clear way of how everyone could be working together. Next slide. And so this last one is to show that it's not just the district, but everything involved in the system is really also about what happens outside of the small geographic area. It's what's happening at national level around policy and politics. It's what's happening at the regional level. It's what's happening at the basin level, because the work that we were doing was really focused on not only WASH, but also water resources management. So this is just one example of how we applied the different components of the 9 building blocks into strengthening the system in the Cabarole district. So I'll leave it at that, and thank you very much. I know, Pippa, I think we're on to the next presentation. So hopefully I didn't take too long, and thanks again.
Thank you so much, Ellen. Really, really great to see that overview and the building blocks, and also the really, you know, the importance of the connections and relationships between everyone, and really having that deep understanding of all the bits of the system. I'll pause there. If you've got questions for Ellen or any of the speakers, please just pop them in the chat, and we'll come to those, either respond on the chat or come to it in the discussion after we've heard from everyone. Okay, great. Thank you so much, Ellen. And over to Joe Keatinge, who's our Health System Strengthening Lead at the FCDO, who's going to talk about health system strengthening. Over to you, Joe. Thank you.
Great, thanks everybody, and really good to be here. I think what Ellen's laid out is there's a lot of similarity, because we are talking about systems in some of the what I'm going to quickly run through. I'm not going to give lots of detail, and so what I wanted to do was to just try and draw out some key points. So if you move us on to the next slide, Lisa. That would be great. I mean, health system strengthening is a key priority for us in FCDO, if you don't know already. It is mentioned and highlighted in our international development strategy that's just been released. We've had a position paper that came out in December. It's a critical part of another approach paper that came out on ending preventable deaths, which is where some of the WASH, the behaviour change is also highlighted, but it's part of VTD delivery, you know, everything we do. So if you give us the next slide. So as we see health system strengthening as, and press again, Lisa, as basically the glue between all of our agendas. And as was said by Ellen, we also think about it in terms of different building blocks and different functions, which is what is in the middle. But it's something that's needed, whether you're doing health security, whether you're delivering essential services, there's commonality. And what we need to try and do is to try and bring it all together so that we bring some cohesion to the work that we're doing. If you press the button just quickly in 3, what you'll find for this audience, for instance, some of you may be involved in some of the health protection, disease prevention side. Some of you may be involved in some of the delivery of essential services, which include WASH. But what you both need on both sides are the health workforce, is some financing, is decent data, is some governance, and is that community engagement. So what I want to try and do is, you know, reflect a lot of what's been said just now, and it is similar when we talk about the health systems, and we go into a bit more detail in the paper. In the FCDO paper that was released in December, which Pippa's kindly put in the chat. So next slide. What I was asked to do was, and it maybe sounds a bit negative, I was asked to give out some key messages on system strengthening. And this isn't just about FCDO, this is just about working more broadly on this agenda. The complexity has already been talked about by Elynn, and it's true, there is no one size fits all for systems. Different contexts require and are at different stages of system development. So when you're thinking about system strengthening, you need to have an open mind, you need to know your context. And what if you really do it that way and don't come with something prescriptive, then you can tend to move the dial in terms of progress. It's also, as was mentioned by Elynn, political. It's not just technical. You've got to consider the political economy, as was said, and that can take time, but it's worth investing in that as you start doing more and more system strengthening work. Again, it's not a one-off, it's progressive, it's something that needs long-term action, which I know is difficult when ODA budgets are all over the place. But it's important to have some kind of theory of change that looks to the longevity of what you're trying to do. And also be ready for flexibility and adaptation. You know, I think it's really important to have that embedded in the work you do on systems. The other thing to say that was already been said is how multi-sector and multi-stakeholder engagement is critical. And that, again, is we're not very good at taking the time to bring narratives together. So I think it's important to have that. And I come back to that because I was asked to give some tips about working with governments. So let's move on to the next slide. So in our paper, what you will see is that we outline some of these kind of core principles that we want to apply to all the work that we do. A lot of them have been mentioned or touched upon and are similar to WASH system strengthening. But leave no one behind, rights, country ownership, making sure we do no harm, and making sure we look at the evidence of what works are really critical for us. And what you'll see in the paper, we go into a number of focus areas. I'm not going to go into them, there isn't time. It's a quick read, have a look. But I think what's important for this audience is the focus on integration, multi-sector, equity, sustainability, and quality of care. Next slide, please. So what I was asked to, I think it's on the next slide. Yeah. So what does this mean in practice? So we're very good and have been really good at dealing with individual programs. What we've not been as good at is alignment, coordination, and collaboration. And what we're trying to do with our systems paper here is really lay out that we really need to up the game to bring different investments, whether they're from WASH, behaviour change, into government sort of thinking, align them to their systems and coordinate so that the whole becomes greater than the sum of the parts. So this is different. This isn't just doing what we've done before, and it's about WASH, service delivery, primary healthcare, nutrition, climate, beginning to talk more together and to work out where there's commonality. What can we build upon? What can we bring together? What needs to remain separate? And again, that requires us to talk to each other more, and we often don't plan enough and think through getting other perspectives as we design our work. And then the important one is doing no harm. Often we think this is the best way to do it, but we haven't really thought through because we're thinking very siloed about what some of the spillover effects on the work that we're doing can mean. So doing no harm is a really important component to think through when we're doing systems work. Next slide. I know I'm running out of time. So I've got some tips for thinking about HSS. I've kind of alluded to some of them. I think the big message here is a lot of people support a health system rather than strengthen it. And you need to take that back and reflect yourselves Are you just providing inputs, or are you actually strengthening the system, which requires more institutional building, thinking more of a whole rather than one element of a system? And then look at how you identify the opportunities to work together, do no harm, as I've already said, and think long term. Next slide, please. I was also asked to say something about the evidence. Just quickly, we're about in the process of doing another revision of the evidence that is on health systems. We should have a summary of what is already a really extensive paper that we produced. Well, we didn't. Sophie Witter and her team of colleagues put together the latest evidence on system strengthening. So have a look at that if you need pointers in terms of what works, and we'll have an updated summary in the coming weeks, hopefully. Next slide. And then finally, I was asked to talk about how to work with government. To be honest with you, this is just a kind of brain dump of stuff. I've worked at a country level for many years, and I think I don't think we spend enough time again to actually working as peers with governments. We often come in with predisposed programs and don't do enough talking to either communities themselves or the ministries that are involved in whichever program we're trying to deliver and support. I think tailoring messages, you know, people don't need all the massive theories and big Venn diagrams. You know, you think about elevator pitches and remember that what the Ministry of Finance wants is different from the Ministry of Health, the Ministry of Education, the Ministry. And I think we tend to just sort of, I think we could do better at adapting some of our narrative. And then the last thing that I would probably focus on here is trying to really link up the narratives. You know, wash systems, nutrition systems, health systems are all important. You know, ministries know that. But we need to find some commonality and a common message rather than competing for bandwidth. And again, that links to the fact that we need to coordinate our activities a bit better. So let me leave it there. That's it from me, and I'm happy to answer questions. It's a real run through. Do read the papers. There's the Ending Preventable Deaths that situates where systems works in the broader pillars. And there's the systems work, and happy to take any questions. Thanks.
Amazing. Thank you so much, Jo. That was a really incredible overview. And thank you so much for sharing all of that. I'm going to whiz straight on to our country level practical sharing now with WSUP, who are Water and Sanitation for the Urban Poor. So I'm going to hand straight over to Tara Vernon, who's the head of global programs and our HBCC2 lead, and also her colleagues Elizabeth Prosser and Emmanuel Owako, who are our program controllers. I'm going to hand straight over to you, I think, Tara, to get us going.
Thanks so much, Pippa. I appreciate it. Please let me know if you have any trouble hearing me. Okay, fantastic. It's very interesting to hear the other presenters because they talked about the essential nature of looking broadly at systems to try to understand the wider picture. By definition, that's what we want to look at in systems. But with us, we're going to be looking at an approach we use to strengthen systems within a utility. So we're looking at a much more kind of focused level. Can I ask you, Elisa, to jump forward like 2 slides? Because I realize we don't have so much time and I'd like to focus on the approach. Maybe the next one. Thanks so much. So we work across 6 core countries and in multiple other countries with our advisory section. But within our core countries, we work really, really closely with water service providers and most specifically with utilities. And WSUP, by definition, works with the urban poor. So we look at how utilities can be strengthened in order that they provide services to the urban poor and what they need to do to improve or to modify in order to connect with those people and make sure that they receive a good and functional working water supply. We focus a lot on reducing water losses and stimulating the demand for low-income customers, because they are a potential customer as well. They shouldn't just be thought of as people that need to be served without receiving any revenue. Can you jump to the next slide, please? So the utility is typically the largest supplier of domestic water in cities, and a functioning utility is a critical part of achieving universal coverage. And this can be like a really tall order considering the extensive responsibilities that they hold, and more so in under-resourced economies. For anybody that's based in the UK, you know that our utilities, even in a very well-resourced economy, struggle a lot at providing consistent water supply and to a high quality to us. So in under-resourced economies, it's obviously a massive challenge. And you can see from this slide, you can see all the wide breadth of mandates that they are expected to cover. So it's not a simple task, and they often don't have a huge amount of funding from the government, or they're expected to be fully private and enable full cost recovery from their customers. So they sometimes don't have an incentive really financially to extend those services to low-income people. Can you go to the next slide, please? So based on our years of experience working with utilities and water service providers in all these different countries, we've been developing a utility strengthening framework. This is a tool that we use to partner with utilities, and it's an 8-step process where we act only as a facilitator. The utility owns the process of utility strengthening, and we work with them to develop ultimately a roadmap for change, including multiple self-identified and manageable projects to improve the functioning of the utility. With the vision for the utility, you can see in the bottom right-hand corner, being engaged staff, loyal customers, long-term financial planning, provision of consistently safe drinking water, and a continuous water supply to everybody in the city. And we believe that all of this works towards the SDG that we're all aiming for, which is about universal coverage. During the 8-step process of the USF, the Utility Strengthening Framework, we work with the utility to gather contextual data and assess the current situation. We secure advocates and champions to drive the self-reflection exercises, including interviewing multiple people in the organization across all different levels. So we don't just focus on the senior management. We work with the operational people that are actually going out and fixing the pipes and everything. We work with the HR department, the finance department. We work with everybody in the utility in order to get their perspective on how they think the utility is running. Can you go to the next slide, please? So in terms of that, one of the most powerful aspects of the utility strengthening framework is that we ask the utility to reflect on their organization themselves and score it according to this utility diagnostic tool. You'll see that the 7 business areas that we divided the utility into, they don't specifically reflect each department that's inside the utility. We did that on purpose in order that we'd mix it up so that people wouldn't just score HR and then the poor HR department would be, would feel very put upon. We ask everybody to score across all of these different business areas. And if we just look, for example, attitudes and behaviors, I know the words are very small, so you may not be able to see, but in there, attitudes and behaviors is divided up into organizational culture, performance management, and talent management, just as an example. So you can see there that those 3 aspects, they could be assessed by anybody in the utility from their perspective about how they consider that utility is running. Once they've performed this self-reflection exercise and all the scores have been gathered, they go through a prioritization process to collect together the areas they think need improvement or areas they're working really, really well. And then we develop specific projects with them that can be very large or they can be bite-sized to work through this improvement process. It can take a long time, but we found that this is one of the most powerful ways to make a utility aim for universal coverage, and also their mindset change for them to realize that it is achievable, that it is manageable, because sometimes if they don't break these issues down into smaller pieces, they can think that it's absolutely impossible for them to ever improve, to ever really gain decent amounts of revenue, to get those last mile connections out to the urban poor. Next slide, please. And I wanted to mention as well that within our HBCC2 project and the first one, we have been working with utilities to work with them to make sure that those water connections are consistent and continuous in order to assist people in preventing the transmission of COVID-19. I'm going to hand over to my colleague, Emmanuel, who's based out in Kenya and has worked both with multiple utilities in Kenya, but also on HBCC. He's going to give the example of us using the utility strengthening framework with Nairobi Water Company. Over to you, Emmanuel.
Thank you. So Nairobi City Water and Sanitation Company is one of the largest utility companies in the country, Kenya, having close to 4.5 million within the city, a large percentage being in the low-income areas, being a large city with lots of settlements in the low-income areas. And being a large utility, it has a number of directorates, almost 7 regions, and employees numbering 3,400. So that is a large utility by Kenya standards. So the water coverage has been quite okay, almost estimated at 80%. With on-site sanitation. But the worrying trend of non-revenue water is around 40%, and that is one of the areas, as my colleague mentioned, is an area that the assessment also addresses. But one of the key areas on the business areas mentioned is the attitude and behaviors of the staff, which is key to addressing some of the challenges. And in one of the reflections for the utility was the lack of incentives, less engagement of the regional staff. As you see, the regions are quite a number, 7 regions. The drive for innovation, staff retention, and training opportunities so that they are able to embrace the innovation and address some of the challenges that are facing the utility. So in the reflection and assessment of their current status across the low-income unit within the directorate, we realized that some opportunities, next slide, present out of the attitude and behaviors that are key to driving the systems strengthening within the utility. And one of them is departmental collaboration. As I mentioned, there are 8 directorates, regions, and of course with units within it. So that collaboration between technical, for example, and commercial strengthens the system in terms of improving service, strategic inclusion of low-income areas so that we are not leaving anyone behind in terms of service, and then performance management system that embraces the talent management and creates the shift in terms of mindset of the staff for service, and of course getting an opportunity for scheme of service so that staff are retained and are assured of growth. So that is an example of just one of the business areas. Of course, we did all the areas, but that is a key area that the utility has been able to address. Thank you. Over to you, Beth.
I'm going to pick up here. I'm aware we've only got a minute or so left of time, so I will fly through this. So I was going to present briefly on our utility strengthening work with Durama, which is Madagascar's national water and electricity utility and probably one of the biggest utility strengthening projects we've taken on to date. So we've been engaging with them on the USF since April of last year, and it's still going now. And so I thought I'd focus quite intently on some challenges, successes, opportunities, and top tips from that experience. So a couple of big challenges to practically implementing this kind of system strengthening work is, of course, scheduling. It takes a lot of time to do it right, but at the same time, you need to keep the momentum going. Quite difficult when you're dealing with a national utility with lots of regions and different departments. Time-intensive analysis. We touched on all this data collection we do and these self-reflection exercises. In Durama, we had 54 participants representing different levels, regions, departments, and working properly through that data to understand the context and the perspectives that the viewpoints you're gathering in what we've all sort of acknowledged are very complex systems. helps us to then pick what to address and focus on, because when you're dealing with systems change, you can't focus on everything, because we've already said, but that really does take time and is, I think, a challenge that we'd all face. And then finally, I think a big challenge is the mindset change element. Obviously, if this influences engagement and the ideas and the commitment you get from all the different stakeholders when it comes to making change, and it's something that we definitely need to address straight away at the beginning. I think it reflects the importance of picking people that are open to change and really getting top level commitment to drive this stuff forwards. So a couple of successes from the work: we really got a breadth of engagement. I think we shouldn't underestimate the importance of getting everyone in the room and clarifying roles, responsibilities, and understanding more holistically altogether these different perspectives, and really opening the space for the communication and the collaboration, particularly amongst different levels. A big success was the mindset change. I think we've managed to start triggering in Drama just that sense of people feeling that they do have something useful to say, and that internally they know what needs to change, and just helping them break down, as Tara was mentioning, those bigger issues into smaller, manageable chunks to actually move them towards their own desired end state. So with Drama, we worked to develop 20 different projects. We moved 10 to project charter stage, and of those they've picked 3 to prioritise and move forwards. And so I think maybe I'll move on to top tips before it takes too much time. So top tips from system strengthening with such a big utility, but hopefully applicable elsewhere, is about getting the right internal advocate, finding those people within the organisation. They're going to help you drive that process forwards, making sure that everything you're helping them to generate aligns with existing goals and strategies. That helps get the engagement and helps encourage them to push it along. Integrating into existing processes and tools rather than giving them lots of additional things, but mapping this additional insight onto things that already exist. And then, of course, identifying some quick wins to start seeing change quickly, because that gives the momentum, the engagement, and the enthusiasm to keep investing.
We can just end there because I understand we've run out of time. But thank you so much. Please, my email's in the chat if anybody wants to ask any further questions. Thanks so much.
Thank you all. That was so amazing. And the power of a mindset shift. I'm a big advocate for that. And great to see all the co-production and investment, breaking it down as well into those manageable chunks and quick wins. Okay, let's whiz straight on to GiZ. I'm going to hand over to Bella Mons and Margaret Lim, who Bella's the regional HBCC project manager at GiZ, and Margaret is our program the program advisor in the Philippines. They're going to share their experiences of strengthening WASH in schools with ministries of education. So over to you, Bella. Thank you.
Yes, thank you. And I will rush a bit so that we perhaps have at least a few minutes left for some exchange. Yeah, we're working with ministries of education in Southeast Asia and now starting also in Africa on the topic of WASH in schools. We go to the next slide. Important to, if you look at WASH in schools, the goal here is to make children fit for school. And if you see this entire picture, it's the framework. Basically, you have, if you look at the bottom, you have infrastructure which need to be in place. You have stakeholders, different stakeholders, which all need to be in the picture. And you have certain interventions which will only be possible if you have infrastructure and people and the stakeholders. But most important is that you have that entire aspect of school-based management at the side, which is stakeholders monitoring and specifically getting into specific routines. And if you look at this to support, sometimes you can make that happen in perhaps just a few schools. But the big question is how to really scale that up. And the idea, the concept here is how to really design programs from the beginning through the lens of scale and how to support governments to scale this up. Because pretty clear, you can already go to the next slide, pretty clear, we as development partners can only do something in a limited number, but to really reach scale, it can only be done by the government. So the big issue is how can institutional behavior change happen and what does it take? Which means how can, for example, how can ministries of education take up the topic of WASH in schools, how to integrate that and really carry it out. And that means clarification of roles. We have heard about, everybody talked about it. We speak about that you need specific guidelines and monitoring systems. And what is needed for institutional behavior change totally is that you need capacity building tools for all levels of governance. Very often we look at the school level and we look at the national level, but what is in between is the subnational level where the ministries of education need all the structure to really get that done.
Can
you hear me?
Yes, we can hear you, Bella. Do carry on.
Yes.
If you could put yourselves on mute, that would be great, please, everyone else.
Yes. You need capacity building on all different levels and really need to capacitate the subnational level. And what is also super important is the alignment of all the different development partners to support the government, this government-driven process to a behavior change and not focus on their own partners program. So important is support the government with this all aligned by the SDGs. And we have very clear direction here. Next slide. And just to see, the next slide. What you can see there is, what is so important is that we focus on principles, that the support even into model schools where you start will be very, very simple, having the system in mind and always have in mind what the system is capable of. Have the system, the ministries of education can only handle a certain part. When it comes to WASH in schools, they have so much on education, they're overloaded, and it has to be something they can carry out, and only then the ministries of education can scale it up, and only then it's sustainable, and only then they can really reach thousands, 10,000, 100,000 of schools. Next slide. And so we need to support them to make WASH in schools easy. Go to the next slide, and we can see that we use monitoring as a tool for scale up. And if you look at the latest SDG report is just coming out as the SDG for WASH in schools, you can still see there's still a huge gap what needs to happen. See realities in schools around the globe is very often a limited access to water, lack of hygiene behavior, and very often limited funds to reach the national targets, and how to really get all schools, as it is in the formulated in the SDGs, to reach basic service level. Next slide. The idea here is to really work on a very simple system. You can click already all, I think there's more. They will use the so-called 3-star approach, where you support schools in the way how they do this in a monitoring system with an awarding to award performance. So they can reach simple aspects by looking what they have on the ground, what is available for them with the resources they have, and not waiting for resources falling from heaven. Then in the next level, coming up with a system where they reach higher service standard, which is with incremental improvements. Perhaps they can even get some additional funds from the local governments. They would know where, they have more knowledge about. And the third level is that they reach really the national standards, because we all know the national standards are very often high in the sky, and it's so important that schools also know what is the pathway to get there. Can you do the next slide, please? So setting up exactly next, you can click it, you should click them all. So we developed this system together with UNICEF in 2013, and many, many countries around the globe have now approached or started to use this system, which helps ministries of education to integrate this aspect of WASH in schools. Next slide. And when one sees how monitoring is being used, you can see that if the monitoring is, and is supposed to be like this, integrated into the EMIS, into the Education Management Information System, part of that will feed into the SDG global reporting. And on the other hand, part will also feed into the nationally designed 3-star approach. And this is a nationally designed system compared to also both is data you gather on country level. One compares countries with each other if they reach SDG basic service level, while you also have the in-country comparison. And this 3-star approach is also used as an incentive within the country to compare, for example, different provinces or different districts, how they perform with respect to this sort of accreditation or awarding system. And that sets a lot of incentives because this data is visible, it's transparent, everybody can see it. And this helps also ministries of education on subnational level to better or be oriented what they should reach and where they are. And go to the next slide, please. Then you can see, for example, this is I use here the system of the Philippines, but it's also now used in Indonesia, in Cambodia. So more countries really using this, and you can see it's a voluntary system, and you can see the number of participating schools over years. And you can also see that they use it as a benchmarking, and they can also use it as part of performance assessment for the school directors, and it's based on transparency and accountability. And the next slide. Yeah, you can see here in this system, it's just one country being used, the Philippines. You can clearly see the progression over the different years. You can see how many more schools reaching a certain star level, and each country develops their star system by themselves. The star level are not comparable between countries, but each government can by this also design the way which is important for them to put into the different star levels. But at the end, they should reach basic service level SDG. Next slide. I think we are through. And just to see, you have more functions for monitoring. It's capacity building, because in each school, with such a checklist system, they would know what they should reach. You recognize performance because you make that transparent, and those who perform well are being seen and being awarded. Of course, this also creates demand, because you can see they engage with the local governments because they want to be better. Data is being used, of course, for planning resource allocation. The whole thing fosters accountability and transparency. And of course, that strengthens the entire policy implementation. So with this, we see that now we do that in 4 countries, and we see how well that increases the entire situation of WASH in schools in the respective countries. But it's only, of course, possible if this is the government system, and we as partners, aligned partners with UNICEF, with Save the Children and others, support all the same system. And here I stop. Thank you for attention.
Thank you so much, Bella. Amazing, amazing work that you're doing. I'm going to hand straight over to Lisa and Geeta for what we've got left of the time.
Thank you, everyone. Those were amazing presentations, super rich and lots of detail. and kind of going from the broad picture to really practical implementation steps. And I've noted a few, but I'd like to give a chance for anyone who wants to come in. The aim of the discussion was to kind of discuss how we go about system strengthening. So if there are any other top tips from colleagues on the call, and you want to come in now and just raise your hand and come in, put your video on, maybe take maybe 3 comments from the audience before we close so that we try and close on time. So please do feel free to just pop your video on, raise your hand. There are a few comments on innovation. I'm just going to fill the space while somebody decides if they want to come in. But there were comments around innovation, around accountability, around inclusion. Just wondering if anyone has some top tips around that. Yep, Tara.
Hi, sorry, me again. We've been running another project in Zambia about looking through a systems lens at the sanitation market in Lusaka. And what we found was doing that project, which is fairly intangible. It's been a very interesting process to go through it. We found that one of the top tips is that don't look at, whilst you want to look at everything, you do have to bound yourself with a question. And so if you want to really make your insight really strong, we looked at financial flows into the sanitation market in Lusaka. And so when we went down that kind of pathway, a little bit like the river in our diagram of the USF, it sort of guides you and you just helps you to be bounded, because otherwise you actually get overwhelmed with information. So but during that process, you automatically end up understanding about lots and lots of different elements. And for example, we didn't only focus on the Ministry of Finance, we ended up looking at all different ministries. So that would be my top tip, is give yourself like a question to answer and then go into the system, or else you'll just be overwhelmed.
Great. Thank you very much, Tara. Anyone else? We have 3 more minutes.
Yeah, just yeah, I think, thanks. I agree with so much has been said here. It's also the trust you need, government need to trust, and that is very difficult with short programs. So it's you need people positioned, they need to really trust, and they need to work very, very closely, best even being positioned even within the ministry. So that's part of how we work, and that's something which helps, because only then you will really understand what the need is and what's the current discussion there and what's the direction of what they want to take and where they really turn to in case they have questions or they want support, and then you can support it, but not from far, and it needs long relation.
Absolutely. Great, thanks. Elynn, please.
Yeah, I think I would totally agree with what Bella said. I think that the relationships are extremely important. I also think starting with assessment is really important. There's a lot of tools that are out there that assess the different aspects, and to take on the system as a whole, you want to understand the basics of the system. And we have tools, UNICEF has tools, WaterAid has tools, lots of entities have a whole variety of tools to assess the system, particularly around political economy. So you're understanding that very large picture, but then identifying where to start. I think for me, that can often be the most challenging. And sometimes starting with where the biggest challenge isn't necessarily the right place to start. It might be something that is kind of a small win, but really the government and the entities and the partners that you're working with need to be in the driver's seat. And so I think making sure that the ownership doesn't sit with all of us, but the ownership really sits within government, so that the assessment that's being done, we're supporting that process for assessment, as opposed to just coming in and doing the assessment. And we're seeing that more and more with things like GLASS reports or TrackFin from a financial perspective, but there's a lot of different tools that governments are really supportive of. So I just wanted to add that in. Thank you.
Great. Thank you very much, Elynn, because that is almost a brilliant summary of the session. I think I just wanted to add that some of the points that have come through are also about measuring and making visible the progress, and this concept of things being tangible. You know, the system is really complex, breaking it down into different manageable parts that you can start tackling on the ground in order to make progress seemed very important. And I think that, again, accountability and this measuring progress is really important. And we saw through, you know, some of the examples how, you know, even water meters and things like that, and prepaid and some of those innovations, just to respond to one of the questions in the chat, are really important as well, and how those get integrated and supporting local businesses in order to do that and integrate them into the system. And so maybe I'll just end on that. The system is obviously a broad range of actors, and they are really central to that, and this concept of trust and building that capacity, the capability of people at the places they work on, the institutions in which they work, and then the whole of the system. And I really loved, Elynn, one of your slides where you showed that, and you showed that within the broader water basin you know, and how that all kind of links together. And, you know, when we go back to systems thinking, a lot of it is around ecosystems as well, but also kind of these broader, you know, these very technical and social systems. So on that note, I think I'm going to end here, and just a huge thanks to participants. Thank you so much for the great questions, and to the presenters. It was a really exciting and insightful kind of session. I wish we had a lot longer, but in terms of just answering another question, you know, what we really need are these stories, and we need the stories of success. And that's how a systems approach will really take hold with I think governments, with donors, you know, partners. You guys are already doing it, and part of this was just to share that experience amongst everyone. So I hope that was really useful for all of you. Definitely fascinating for us on our side, and from what I can see in the chat. And I think I'll just wish you a lovely rest of day or evening, wherever you are. So thank you very much. And if I haven't forgotten anything, Pippa, then let's say thank you to everyone.
Thank you, everyone. That was amazing. Really interesting. Great work. And I'm sure we'll be carrying on talking about this.
Great, thanks.
Thank you, everyone.